more minutes to show up. We're expecting a full house today. Let me go over some housekeeping really quick. For anybody who needs the restrooms, they are right outside to the right. We've got refreshments, plenty of snacks for you guys to keep you going throughout the meeting. At the front of your desks there, you're going to see some materials that we want you guys to take a quick peek through. We've got the Medicare and all that jazz flyer that's got some great resources and details on there. So we've got, hello, welcome. So on here, we have the Medicare Part B premium for next year. It's actually going down. That never happens. It usually goes up. So woohoo, you guys get about a little over $64 a year in savings. We are still waiting for the Social Security cost of living adjustment to be announced. It is expected to be an increase, but nothing formal has been released yet. When we get that, we will definitely let you know. Another key thing that we've identified just through common trends, calls, messages that our office receives, Medicare does not make outbound calls. If you get a call from somebody who says this is Medicare calling, it is likely a solicitation. It is extremely rare that Medicare would ever reach out to you. So record that number. If you're not sure, just call our office. We can do a cross check. And again, please be very careful. We've had several clients this year say yes to something they didn't realize was accepting a plan change. And then they got enrolled on a new plan. It canceled their current coverage and it made a whole mess of things. So please be very, very mindful. I also want to address the common questions I get about the wonderful Medicare commercials you're seeing with Captain Kirk and JJ Walker. These are national commercials that most likely don't even apply to Idaho plans. So if you see something that's offering to pay for your groceries or your pest control, and you're like, I want that plan. We don't have those plans here. And remember, these commercials are designed to lead with the flashiest benefits. We shouldn't really be making plan decisions on pest control. We want to make sure your medical needs are covered because medical bankruptcy is the #1 cause for bankruptcy in the United States. So let's make sure we get the priorities down. Hello, welcome everybody. Come on in. Please review those worksheets. For those who are attending virtually, we will get that information out to you digitally as well. You'll also see some other resources about prescription drugs. For those who are taking expensive medications or a lot of medications that equal over $4,000 a year, you could be subject to the donut hole. So we've got some information about what is the donut hole, how does that apply to you, how does that change your out-of-pocket expenses. And again, we do get creative in our office. We will use GoodRx, which is a free prescription coupon service. Everybody who's attended here today has received in their bag a GoodRx coupon card. I'm going to recommend that you go online to get the most current pricing and verify where the best price is because it's going to vary by pharmacy. Each drug may have a different price with every pharmacy. So please, before you refill medication, if you're using GoodRx, you're double checking the website for the most current information. We also will use manufacturer coupons, patient assistance programs through the hospital, nonprofits and charities. And we also have partnered with a local mail order service called Universal Prescription. They are legally and safely able to get medications from manufacturers in Canada, UK, New Zealand. We just helped a gentleman get a 3-month supply for the cost of 1 month here in the United States. So again, sometimes we have to get creative and compare against your plan and find what is going to work best with your needs and budget. And we're going to encourage that you guys send to us your prescription list so we can start doing those comparisons and research for you. Without further ado, let's get to why you guys came here. The point of today's meeting is to go over the plan changes to the United HealthCare AARP Medicare Advantage Focus HMO plan. Now, United HealthCare has several plans. If you're not sure which plan you're on, go ahead and pull out your ID card. It'll say, I believe it's on the bottom right-hand corner. You want to double check. This is their zero premium St. Luke's plan, okay? So we're going to go over the changes. I'm also going to go over benefits that are just a refresher for you to make sure you're utilizing all the benefits and just some commonly used services that we're seeing. And I'm also going to be going over best practices. Again, we've collected trends of calls, emails, service request items. Today, we're going to educate you and empower you to be your best personal advocate and how to avoid claims and service issues. So let's go ahead and get started and show you how great this plan is getting. They've made some big enhancements. First off, no change in monthly premium. Woohoo! So still zero. We love that. And then you couple that with the lower Part B premium. That's some extra savings and money back in your pocket. So we love that they're keeping it zero cost. Everyone has to pay the Part B premium. High income earners are going to pay more than the $164.90. If you do earn a lot, I've got the income levels over on the table over here for income related monthly adjustments, or IRMA. So if you've received a letter from Social Security that you are going to pay more, you want to check out that flyer. But most people are paying the $164.90. Okay. So no additional cost for the plan. Happy to announce that the max out of pocket has also been reduced. So we went from $4,900 to $4,500. It's a $400 savings. I want to talk to you guys about a couple of things with the max out of pocket. As a refresher, your max out of pocket is the most you're going to spend in a calendar year towards your medical expenses, inpatient and outpatient. It will include the medications you receive while you're in the hospital or in a doctor's office, but it does not include your prescription drug costs that you get from the pharmacy, because that's a different bucket that we, again, call the donut hole. So make sure you're looking at those flyers if you need more information on that. But your max out of pocket is your stop loss. This is the most you're going to spend in a year on medical services. Less than 3% of membership are hitting this max out of pocket because the copays are designed to be so low that it takes you a really long time to get there. So shouldn't have to worry about that too much, but it's there so you know what the worst case scenario is if, God forbid, knock on wood, you have a rough medical year. I want to also reiterate the importance of a primary care physician, especially now more than ever. You want to have a doctor that you have a good relationship with that can help manage your everyday medications, your everyday needs. It's going to save you a lot of money. Zero copay to see a primary care doctor. And with how many people are moving into Idaho, the wait time to get into a specialist is longer than it's ever been, sometimes over 8 weeks. So if you can, again, establish great relationship with your primary care doctor, not only are you going to save money, but you're going to be able to get in quicker. If you do need to see a specialist, you are going to see a reduction of $5 on the copay from $30 to $25. So a little bit of a savings. But for people who are going quite often and having to do frequent follow-ups, that savings will add up. Again, try your best to run as much as you can through your primary care doctor. But when you have a specialist, it's $25 for the consultation. Yes, John?
So the idea is, on these co-pays, is if we live long enough, we're going to have zero co-pay, right?
Yeah, I mean, hopefully the goal is that these plans get better and better every year. This is actually one of the largest financial investments United HealthCare has made on our plan, because we've got more people and they're thriving. They're doing really well, and they're finally enhancing these plans where you can go into the doctor's office with confidence, knowing it's not going to break the bank. So nothing's going to burn a hole in your wallet. I'm very excited with what they've done with this plan this year. Nothing changed on the inpatient hospital stay, but I want to remind you of a few things. I like to joke that this works almost like an all-inclusive resort you never want to stay at. You're going to pay a per-day copay of $275 a night for the first 5 nights that you're in the hospital. That's going to cover everything that happens to you while you're there. Your room, your food, your lab work, your imaging, your doctor consultations, your surgeries, all of that included in that per-day copay. So that's not even half of what your max out of pocket is. Doesn't matter if you're there 2 weeks, 2 months, you're still only paying the first 5 days. Couple of key things. Just because you are assigned a room in the hospital does not mean you are formally admitted. We have had clients that find out after the fact that they were actually billed or charged under observation. Technically, the hospitals should be giving you a notice that says you're here under observation, but that doesn't always happen. So I'm going to encourage you guys to ask that question when you can. It's not that it can't be fixed later, but it would be great if you guys can identify that in the beginning. Why is that important? There's a difference in billing. Inpatient is all inclusive. Outpatient is itemized per service that you receive. You will notice a difference in your bill. I promise. It's going to look a lot higher. Yes, question.
Okay, on this inpatient thing then. So you pay $275 and that covers everything, room, the whole 9 yards,
Yes, sir.
except for physician costs, right?
Nope, it's included in your per day copay.
Oh, well, that's why then when I had my surgery, my back surgery, we didn't get any more bills. We just got that one.
Yeah.
And that was it.
Exactly. That's why it's very important to identify and make sure you understand the difference between inpatient and outpatient. You want to ask that question about outpatient because you will notice additional charges for every service you receive. You will have a charge. Okay. Yes, Julie.
How do you change, if they want you to do the observation, how do you change it inpatient?
So it's really not, sadly, it's not up to you, but here's what I tell people. If you're being treated medically, and I'll give you a quick story. So we had a client who was in the hospital for 5 days. He was charged under observation for 3 of those days. He ultimately needed a skilled nursing facility, which is when you don't need the hospital anymore, but you're not quite ready to go home yet, like an inpatient rehab center. Well, Medicare has a rule, a 3 midnight stay rule before they'll pay for a skilled nursing facility. Now, this gentleman was being medically treated. They were not observing him. He was receiving medication. He was receiving medical services. So let's look at the definition of observation. Observation is we're keeping you overnight, making sure there's no complications, making sure there's no issues. We'll be there to support you if you need, but we don't think we need to intervene. So if they're treating you, but they're billing you as observation, that's not right. It would be very easy for us to fight that like we did with this gentleman. I mean, it took us a little bit to finally get the codes updated, but we finally were able to get that corrected. And then all of a sudden, the rest of his claims were covered completely different with the inpatient copays. So that's why I want to bring it up to you because it has happened with clients that it's affected their billing. Yes.
So if we go in under observation, I happen to need medical treatment, that day or later, do they get switched over to in-hospital right away?
Not necessarily. That's why we want you guys to ask that question.
Yeah,
How do you know when they say, well, we're going to give you a bed for the hospital? How do you know? So do they say?
Not all the time they do. That's again why we want to educate you. You have to ask that question. And remember, who is in charge of billing? It's not the people who gave you the care at the hospital. They are sending their doctor notes over to a third-party billing company that is translating them into codes. So sometimes things get lost in translation. Sometimes you get somebody who's better at their job than others. So I'm trying to make sure you guys know that there is a difference and you have to pay attention. You can't just go off of the bills that you're getting. There needs to be a cross-check. And did you know you have 1 year from the date of service to contest a claim? If you find out 2 years from now that something was billed incorrectly, too late. So you guys got to pay attention and act upon receiving those bills. And there's a question online that I want to address too. Yes, Levi.
Yeah, someone online wants to know, do you fight those inpatient, outpatient battles for us?
Yes, we do. We absolutely do. And what we would need from you guys is a copy of the bill, the explanation of benefits from the insurance company, and we would be able to put those pieces together. So that is a service that we offer at Shores Insurance, is to help advocate for you. I joke that I have a pair of pink boxing gloves I keep in the office in case I need to beat anybody up for you. We do it all day, every day. Okay? Yes?
So I'm curious, so if you're in an accident or you had a heart attack or a stroke, you can't communicate because you're not there. You don't. I mean, they take you to the hospital. But you know, if you're not conscious, how would you know? I mean, not necessarily if your husband or wife wouldn't be with you.
Again, this is where you have to, it's not something that can't be fixed after the fact. I'm just trying to educate you on how to read your bill, and then you would be able to go, hey, I don't think this matches what my experience was. I recall being in the hospital for 3 days, receiving care. How come all of these things are itemized? Jenna said it's an inpatient, all-inclusive copay. Oh, that's a call to Shores Insurance. So you're absolutely right. You may not be in a state where you can ask those questions and advocate for yourself in the moment, but that's why we want you to know how to read your bill.
And then while you're advocating your bill, you don't have to pay your bill while you're in the process of that,
Correct.
contesting. That's what I want.
Yeah.
They're not gonna be charged.
Yeah, do not pay a bill until you verify that the claim has been processed correctly.
What if the hospital says we're turning you over?
If the hospital says we're turning you over to collections, you say, I'm sorry, this was not billed correctly. I'm alerting you of that. I am contesting this. I have a right. That's why I have insurance. I have insurance so I don't have to pay the big bill up front. Insurance isn't a refund policy, right? And they're quick to take your money. They're not so quick to give it back. So when they do their job, then you're happy to pay the bill. But until they get it right, I'm not paying the bill, and I don't have to pay that bill until my insurance has properly paid that claim and you've provided the correct information to the insurance company. So there's a couple of processes that the insurance companies have. There's an appeal process. What is an appeal? Appeal is, I don't agree with how you paid the bill. I want this reconsidered. There's also a grievance process. Grievance is, I'm not happy with the care I received. I'm telling on you to the insurance company. They're going to know I'm not happy with you, provider, or you, hospital. So sometimes we have to file both of those, especially if you're getting a hospital that's threatening to send you to collections but haven't addressed your concerns about the billing. Hey, this hospital is not returning my phone calls. They're not addressing the issue. And now they're threatening to send me to collections. Insurance company, I want you to know. And there's also a formal process to file a complaint with the Department of Insurance. It's called a consumer complaint. So once Department of Insurance gets involved, it's a whole nother ballgame. They're going to ask questions. What did you do, hospital, to remedy to this? What did you do, insurance company? And they ask for all the supporting documentation, and you're supposed to get a response within 30 days. So there's multiple options. Sometimes we have to use all the options. Sometimes it's a quick phone call. Just depends. So let us know as soon as you know. All right, let's move on to drug coverage because we got an exciting enhancement. They're getting rid of the deductible. There was a small deductible of $100 that was only applicable to name brand and specialty drugs. If you were taking generics, you didn't have to worry about it. Most people do, so that's good. It's a great way to save. But they've now eliminated that deductible barrier for name brand and specialty drugs. All the copays, as you can see, remain the same with the exception of the specialty tier. That one did go up by 2%. But again, sometimes what the insurance companies will do is they'll take from underutilized areas and reallocate the funds to an area that has more of a need or more of a demand to bring the bigger savings across the board through all of their membership. So that's what you're seeing here. We took a little bit from here to make this better over here. But other than that, amazing drug formulary, very robust. Do not assume because your drugs were covered one way this year, they will be covered the same way next year. It's good to double check. I see many times that a drug will go from the preferred brand name tier to a standard generic tier. It all comes down to contracting, dollars and cents. Very political sometimes.
What about the other way?
Yeah, I've seen it where a drug was covered and now it's not. Now, technically, the insurance companies are supposed to send you something in writing if they're discontinuing covering a certain medication. So it's not like you're going to be blindsided when you go to the pharmacy. What I am saying is we need to take a proactive approach. No more assumptions. Let's get into the routine and the practice. You send us your list of doctors that you want covered, your list of medications that you're taking. Let us verify it and tell you exactly how it's covered. If we see additional savings by using one of those resources that I was mentioning, we'll let you know that too. And then you can go into the next year with confidence because you know exactly what it's going to cost before you even go to the pharmacy. Okay, so I just don't want you guys to think, oh, because it was covered this way last year, it will be that way next year, and then you find out the hard way, and then you call and go, what the heck happened? We have those resources available for you. That's what we're here for. You can call, text, email, live chat us on our website. We try to make it as convenient as possible. Okay, and you can send picture text messages to us as well. Yes.
And mostly I got dressed by accident. Well, I didn't know I ordered them. They let me send them back.
Oh, good. Did you use them?
$300.
Yeah. Well, that's a big, that'll make a difference. Absolutely. And did you use mail order? Did you go to the
Mail
pharmacy?
order.
Yeah. A mail order is really nice. I'm actually glad you brought that up, Julie, because mail order, they give you 100-day supply versus a 90-day supply. So for my snowbirds or my clients that like to travel a lot, it's really nice to have a little surplus on stock, because then you don't have to worry about a refill while you're out traveling. So additional savings. And then on tier 2 with mail order, you would have no copay. It's 0 on mail order. So there is potential savings on the mail. Oh, you're fine. Come on in, guys. Welcome, welcome. You got it. So remember, I said I was going to do something different with these presentations. We are going to do pop quiz, best practices. Everybody got a dum-dum on their desk. We want you to eat the dum-dum, but we don't want you to be a dum-dum about healthcare. So we are going to up our game in how we support you by trying to address some of these things in advance. So let's talk about this. Who ultimately is responsible for verifying a doctor is in network? Yes, it's you. It is not the bubblegum chewer at the front desk who schedules the appointments. If you ask the people at the front desk and they say, oh yeah, we take United HealthCare, well, did they look up your plan specifically? Because United HealthCare has multiple plans with different networks. So how can we support you with that? Well, again, call, text, email, live chat us on our website. You can call the carrier. And if you guys haven't created a member portal, please go online to medicare.uhc.com and create a portal. All you have to do is register with your ID number that's on your ID card. They'll ask some basic questions. You create a username and password. Right on the homepage, it says, find an in-network doctor for your specific plan. There are claims that you can see all the details on, so you know what's going on. You can view your over-the-counter benefit allowance on there and how much amount you have remaining. You can use your gym membership benefit through there or see what gyms are available. They try to put everything in one hub for you guys, and it's just an underutilized benefit. They put a lot of money into enhancing the member portal, so there's more features for you guys. It is pretty user-friendly, but if you guys are overwhelmed or intimidated by the technology process, you can call us. We'll stick Levi on you because he's our tech guy in the office. So keep those things in mind. Remember, the doctor's office is not responsible for telling you if they're in network. We want you to call our office or go to a trusted site like the insurance company directly or your member portal. Super excited about this one. The dental benefit is getting better, yes?
So I just got a question about, it said checking with the doctor's office isn't responsible for that. But what a case with Levon where they were putting in the wrong code for a MRI or whatever, and we're getting refused by the insurance company because we were going, double checking it all. And doctor's office it took a long time finally get them to do the right thing to do it. And they claimed, the doctor claimed that insurance companies were tighter after the COVID thing, that they weren't authorizing all the same MRI things that they used to.
Oh, interesting.
But they didn't, it was they were doing MRI, but with the contrast, they didn't want to.
They didn't want to pay for the contrast?
Yeah.
Oh, interesting. Yeah, I'm telling you, with these, with any plan, really, the codes are so critical. And not just the codes. The doctor's offices need to include patient notes, any imaging records that they've already collected. They really need to paint the picture as to why they're offering a service.
United HealthCare needs to get their stuff together because we went through the imaging, St. Luke's imaging, and got the code and everything from them, called United HealthCare to verify that it was under the in-network and paid and all this and that. And they couldn't give us a straight answer, and we're supposed to get back, and never got back. And finally ended up calling the imaging office at St. Luke's, and the gal down there said, it's checked green, you're good to go.
Yeah.
But that's as far, it took us all that to do.
I will tell you that customer service, and I don't know if they put this on their recordings, they can tell you what your summary of benefits says, what your contract says is supposed to be covered, but they can't guarantee payment. There's a specific department, it's the pre-authorization department that's responsible for that. So you may run into that issue with calling into customer service, absolutely. And I understand their customer service sometimes is a little bit difficult to understand because you may get somebody from another country. So we do recommend you call our office for those if you want to avoid that headache. We can give you some tips and tricks. I do have a slide on that actually, so I'm excited to tell you about that. Might be helpful, but even those things that you're log jammed on where you're, hey, my doctor submitted this and we haven't gotten a response from the insurance company, let us know because we actually have internal resources that we use. I know all the big muckety mucks there. So if I need to escalate something because something is, again, log jammed, we can send that up to management for review and push it through versus calling customer service.
Well, the customer service put us through pre-authorization, everybody,
Oh, wow. See, that's why I'm saying you probably needed the next step up. So call us on that. Let us fight that fight for you. We can get somebody bigger involved. We would need to know what steps that you took so we can paint that picture to management and be like, hey, we need an answer today. We've already done X, Y, and Z. We need an answer today.
What they ended up saying, United HealthCare, they needed to do a peer-to-peer, so the doctor's office and United HealthCare needed to talk about the code or the CT instead of an MRI with contrast, I think is what they ended up doing.
Right.
So it's like.
Well, keep this in mind, guys. Yes, your doctor may recommend something, but insurance companies are still a business. They have to have certain protocols in place to protect themselves from abusing services, fraud. They're going to also find cost containment measures. Why are you recommending this big expensive service? Did you try X, Y, and Z things that are much less expensive? There has to be a medical justification. You can't just skip the line and go straight to the big surgery if you haven't tried medication, you haven't tried physical therapy. So from a business standpoint, put yourself in the shoes of an insurance company. I'm not trying to say it's right, wrong, or indifferent. I'm just trying to explain there are protocols in place that your doctor's office can't just jump fast and fast track unless it's an emergency situation. Nobody is going to dispute that. If you need a imaging because you're having a heart attack at the hospital, nobody's going to dispute that. But for the outpatient elective procedures, absolutely, they're going to ask those questions. And your doctor should have been able to answer that or provided those justifications. So peer-to-peer, just so you understand, I'm sure you got an explanation, but for those in this room, a peer-to-peer is your doctor talking to a doctor who works for United HealthCare, and that doctor wants to understand why you're recommending this service. Why are you choosing this right here when if it were me, I would have looked, and if they've already checked all the boxes, it should be a quick phone call. Oh, already did this. Oh, maybe this little notation because of this symptom here. This is why we're putting her on the fast track. It's entirely situational. So I'm not trying to defend the insurance companies. I'm just trying to say they have talked to us agents about why things are the way that they are. And there's a business strategy to it. So I like to remind people that is a little different because a lot of times, we want to think, oh, they just don't want to pay for it. But there has been somebody else that ruined it for the rest of us because they fraudulently or abused the system to try and get a higher payment. So that's why we want you to call us. If you've gone through all of the hoops and you're still not able to make movement, let us send that up to the managers. We'll get it taken care of. We see that all the time, and we're able to get same-day responses a lot of the time, or something resolved within the same week that you let us know. So, but thank you. I want you guys all to know that that's available to you. So I think that's important. Okay, remember the dental benefit was a really popular one when it came out a couple of years ago. They're enhancing it. They're giving you $500 extra. So you're going from $1,000 benefit limit to $1,500. And they're now going to cover dentures and implants. You can now go out of network if you want to. Just know your money may not go as far if you go out of network because there's not that contractual agreement for the doctor to accept or the dentist to accept that as payment in full. Let me give you an example. Let's say you go in for a cleaning and a contracted doctor that's in network is going to charge $100 for the cleaning, just keeping it simple math. But you want to see Dr. Smith, who's not in network, and he charges $150. United HealthCare is going to pay the $100, but you can be billed for that remaining $50 because there's no contract there that says that dentist has to accept that as payment in full. So please be mindful. It's not to say you can't see who you want. Your money, your allowance just may not go as far. But this is really nice because, again, dental is very expensive. I'm not saying that $1,500 is going to meet all your needs. If you have 3 crowns, an implant, a root canal, and a bunch of other stuff, $1,500 is maybe going to cover one of those things. So there's still a strategy. And sometimes people still need to add a standalone dental plan. And you can do that anytime throughout the year. What we recommend is you get a treatment plan from your dental office that has the procedure codes and what they're going to charge for those services, and we can compare that against a dental plan, and we can show you the math puzzle if it makes sense or not. I just had somebody the other day give me a treatment plan, and the cash price was better than the dental insurance. And I was like, I'm sorry, I can't beat what they're offering you. I know, isn't that weird to hear your insurance agent say I don't have a good insurance policy for it to sell to you? But I'll tell it how it is. I can either beat it or I can't beat it. And again, you can add those anytime throughout the year. Medicare is primary. So if you buy a secondary plan, this plan will pay first, and then whatever plan you purchase would be the secondary coverage. Okay? So this is a great enhancement. Yes.
Is there a waiting period?
There's no waiting periods on this plan. If you buy a standalone dental plan, it's going to be subject to whatever carrier, but most carriers have accepted that the dental coverage you've already had in the plan is credible coverage, and they'll waive the waiting periods, which is really nice. Yes.
So if you get an implant, only $1,500 of it would be covered.
Yeah, which an implant's like $3,000. So
4.
yeah, just depends on the dentist, the materials, the tooth, all that fun stuff. So it still may not be enough to cover everything, but you got $1,500 allowance on a 0 premium plan that's just built in automatically. So it's a stepping stone in the right direction. Like I said, it may not meet everything. I will point out a couple other things. We're waiting for the 2023 dental code list to be generated. We're going to send that out to you. The codes that are on the list are the only things that are covered. If it's not on the list, it's not covered. We're going to arm you with that information. We want you to give a copy to your dentist office and say, this is how my plan works. The best advice I can give you for a smooth claims experience is that you request a predetermination. Predetermination is the magic word for anything outside of a cleaning. If you need a crown, if you need a root canal, please ask your dental office to run a predetermination with the insurance company. What does that do? They have to list the procedure codes that they want to perform prior to performing them. They have to include chart notes and imaging records. Why is this important? We have found with several clients that the dental office provided a service and then found out after they sent the claim to the insurance company that they didn't follow the criteria under the plan. United HealthCare requires a certain percentage of tooth decay for certain services before they'll pay for a crown. How would you know that? Do you know what percentage of tooth decay you have? Because I don't. The only people who are going to know that are the dentist. So again, everything is about proactive. How do we avoid the frustrations, the claims issues? We want to run a predetermination. I want to guarantee in writing that this insurance company is going to pay on this service before I rack up a bill that I can't undo. Nobody wants to go through an appeals process. It's not fun because then you're just waiting and you're hemming and hawing. Are they going to overturn the decision? Am I going to be stuck with this big bill? No. Let's get you some of those guarantees that are going to make you feel good, okay? Yes.
Okay. I'm a little confused, Jenna.
Okay.
So I've already changed to a supplemental dentist and given that information to my dentist for cleaning, and it cost me $60 out of $70 bill. Because the supplemental, which is Delta Dental, is only paying $10. Am I supposed to be giving this insurance information along with?
Yes, ma'am. So Medicare, oops, excuse me, let me not pull that out. Medicare is primary. Use your $1,000 benefit because it's included at no charge, and that saves you a $60 copay on your Delta Dental Clear plan because I know that plan like the back of my hand. It's $60. That's clear. Okay, so all you have to do, because remember, within a year of that claim, you can have those rebilled. Just call your dental office and say, hey, I forgot that I had a dental benefit under my United HealthCare plan. Can you please rebill that claim with United HealthCare as primary? Because Medicare is always primary. And then you will either have a $60 credit on file, or you can ask for that money in the form of a refund, full refund.
Well, I have a root canal on Monday.
Oh, well, perfect. Keep the credit and apply it towards the bill.
Well, it's with the endodontist.
Oh, okay. Oh, gotcha. Then I would.
Back to him. But yeah, just my standard cleaning was.
I would run all of your cleanings through the United HealthCare benefit. Absolutely. You want to use that Delta Dental for the big stuff after you've exhausted the $1,000 allowance.
Okay.
Yep. Absolutely. Does that help?
I think I just saved a lot of money.
Yay! Woohoo! That's why we love these meetings. Okay, I got 2 hands up here. Ladies first. Sorry.
So he had cleaning, and then they wanted to do a deep cleaning, which required sedation.
Mm-hmm.
So I says, no, you need to find out if we can get that. You know, and have them submit a pre-authorization. And the letter I got back was saying it's not covered because you already had a cleaning. So what does that mean?
There is a limit on the number of cleanings. They only cover 2 cleanings in a year. So if this was an additional cleaning,
Okay.
yeah. So
They
that's
didn't
why
really make that clear.
I got to get you those codes. I have the 2022 codes. I haven't seen the 2023 post yet. So yeah, so we'll get you those because that is going to be like the Bible right there for dental coverage. It tells you what's covered, what's not covered, and it'll include the limitations on the cleanings too. Usually sedation sometimes is a little bit tricky. Sometimes Medicare doesn't cover that. Most dental plans sometimes don't even cover that. So again, we have to compare against the codes. And if you're not sure, you can always send that to us and we can look at it in 2 seconds and tell you too.
I was just gonna resubmit it next cleaning before he had his cleaning.
Yeah.
And they see what the letter says next.
Oh, gotcha. Yeah, so there is limitations on the number of services sometimes. Any other questions? So far, so good? All right, let's talk hearing aids for a second. We're enhancing the hearing aid benefit because hearing aids can be really expensive. Now, United HealthCare has several models to choose from. I just list the range from low to high. So you're going to save about $200 off the highest end model. And they all have varying, technology enhancements. So it really depends on what your needs are, what the audiologist is recommending. You do have to use United HealthCare Hearing. We are waiting for the updated 2023 vendor list that has all your member extras like the gym membership, the hearing aids. We're going to get into the personal emergency response system. I've got the phone numbers and the website links. So we'll give those to you so you guys can have that number right on hand. You give them a call. They schedule an appointment with an in-network United HealthCare hearing provider. And then you can go and get that covered in full for your hearing exam, and they can make those recommendations. We've had people compare that to Costco, and there is sometimes the savings, and people really like the difference in the models. So it's worth investigating. And there's additional warranties built in, additional adjustments. If you pick a model with batteries, you can get additional batteries. So there's perks for using the United HealthCare hearing benefit. It's just worth investigating, and then you can compare that to any outside vendor that you want to choose. Yeah.
Do you have a list of what hearing aids are covered and not somewhere?
We
Brands?
No, not right now. We can look to see if United Healthcare will post those soon. Because open or annual enrollment period hasn't officially started, some materials we have to wait for October 15th before they'll release that. So as soon as we get it though, we can. Heather, can you make a note to send him that information? And if we can pull it down, we'll send it out to everybody.
Well, see why I asked that is because I got these hearing aids. There's a long story, but anyway, long story short, these weren't on their list, but they gave me a discount. They didn't call it a copay. They called it a discount. And it was substantial discount on these hearing aids over what I could have gotten anywhere else.
Oh, nice.
And so there's another little game plan in there that besides just those.
Oh, I'm sure.
And I called them direct and they told me what all of the stuff was. And I got somebody who could actually speak
English. It's key, isn't it? It makes a difference.
Anyway, yeah.
Especially if you can't hear.
They're hearing aid people. They have a special hearing aid. So, yeah.
What?
What? Was that English? I don't know. Yeah, I'm sure there are exceptions to the rules because, everybody's needs are different and maybe they don't have a solution for your particular needs. So they're able to make something else work. But yeah, you're unique. Special. We love you. I'm just giving you a hard time. But yeah, I would never be afraid to ask because the worst they're going to say is no, right? So we see network exceptions all the time. For example, we had a client that just had a really rough time with a surgery that she'd had multiple times, a mesh repair gone wrong, multiple corrections were made, and just created more issues. Her organs were slipping, she was on more pain meds than I can imagine. Anyway, we were able to get a network exception for her to go to one of the best surgeons at UCLA Medical Center, and they weren't even in network on her plan. But we presented the case and we explained what she had gone through and how we really couldn't afford to go through another surgery that wasn't successful, the effects that it had on her quality of life. And the insurance company took that into consideration and they looked at her claims history and were like, yeah, we're spending a lot on the same issue over and over. We really do need the best of the best. Let's go ahead and approve that. So that's why I say, don't be afraid to ask. The worst they can say is no. All you got to do is give the full detailed explanation of what your scenario is and kind of advocate and fight for why you think you need this. Yeah. Play on the heartstrings. World's smallest violin. Let's bring that out, right?
Yeah, but a lot of hearing aid people, of course, you said there's a list of UHC
providers.
Mm-hmm. I did it backwards. So I had my own, and then I asked them, do you guys do Medicare?
Oh, gotcha.
And
it worked out.
Because one of them in their process did, but you got to be careful with that.
You really do. Don't rack up a bill that can't be undone.
That's right.
Because remember what we said on that first pop quiz question, who's ultimately responsible? It's you.
And they don't, I got the feeling they don't like to do the Medicare route because they don't make as much money on hearing.
Probably. It always comes down to money, doesn't it? Profits. I know. It's really sad. But that's why we want to make sure you guys know there is an actual number that you can call to get that guarantee that you're going to get an appointment with an in-network doctor.
So curious when you said your example, UCLA, that person had to go then to California.
Mm-hmm.
So you've got that trip plus another surgery. I can't imagine they could afford all that. I mean, they weren't covering it anymore. I mean, would United HealthCare cover your flight down?
No, not necessarily the flight and the hotel costs. I don't think any company really would take on that kind of cost, but they did cover the surgery as if it were here in Idaho, the same price. And I'm sure that within the hospitals, they may have some sort of benefit. I know like Ronald McDonald House has a benefit. So there's certain services, again, that you can get creative and working with your doctor to say, hey, is there anything that you guys have within your own office of resources? Because, you do this for a living that could help us with the travel costs. But sadly, yeah, I haven't seen Medicare pay for a hotel stay or a flight other than a medical transport. Yeah, so, but you know what? It was worth it for her to not have to go through another surgery that wasn't going to give her the results she wanted or the quality of life that she deserved.
Did she get the results?
She did.
Okay,
Yeah,
check
she
them out.
hasn't. She hasn't had a reoccurrence since, and her prescription drug list has been reduced significantly. So she's back to living her life, and she's got little kids, so she's gets to be mom again. That was the big thing, is she was in so much pain that her husband had to take over pretty much all the care. So yeah, success story. They do happen, guys. We hear them all the time. I want to talk to you guys about an underutilized benefit as well, the personal emergency response system. Now, most people look at that and go, I don't think I need that. Hold on. We've got clients that are getting very creative with how they're using these benefits. So the personal emergency response system, very similar to Life Alert, but enhanced. And no, this is not like the lady on Life Alert commercials, help, I've fallen and I can't get up. No. There's new ways that you can use this service. So at no charge to you will you get the device. You will get the monthly monitoring service. You do not need a landline to set this up, which is awesome. The device itself is a two-way communication device, fall detection, waterproof with GPS monitoring, which means it doesn't go off cell phone towers. So if you're in a rural area or a spot where there is no service, that's fine. They can still find you. So a couple examples of how our clients are getting creative and using it. We have one client that goes mountain bike riding in areas where there's no cell service, and he and his wife have this deal. If you're not home by 3:00, I am calling in the cavalry. Gotta get that right. Cavalry. Because she's worried. I can't reach you. What if something happens? So now he takes this device with him, just sticks it in his pocket. Doesn't have to be on display on your neck if you don't want. You can just stuff it in and tuck it in. Anyway, it has the fall detection. So if he falls on his bike and he's not responsive, they're going to send first emergency response responders there, and they're going to also notify his wife, who is on his emergency contact list. So he gets to live his independent, active lifestyle, and his wife is happy. Next story, we have a client who lives alone. She sees a peeping Tom in the window, freaks out, doesn't want to overreact and call 911. So she hits the button, says, hey, I'm a little worried. Can you just stay on the line with me? And if I scream, call everybody. So she uses it like ADT, a personal security system, because there is the emergency responders that will come to you if need be. And then we also had another client that got lost and got turned around and was very flustered and overwhelmed. And he just hit the button and he was able to get help to come guide him back home and make sure he got there safely. So it's just nice to have. We've had situations where a client had a surgery, and yes, they were with family and friends, but they left to go run errands, get groceries, got out of bed, couldn't feel their legs, fell, hit their head on the nightstand, unconscious until somebody came home. You just don't know. You don't have to be the old lady in the commercial who's saying, help, I've fallen. Things happen. You don't have a crystal ball to predict that. This is included at no charge. Make sure you're taking advantage of all the benefits that are available to you. It's not a bad idea to have extra help. I will say, please bring it with you into the shower, because most falls happen in the shower, and that is definitely not a situation you want to be stuck for hours in. So it's available. Feel free to use it.
How large is the device?
I actually haven't seen it in person, but from what I think, it's probably about that big. From what they've told us in the trainings, they said it could fit in your pocket. So that's what we were told.
In the shower, you want it in your pocket.
No, you don't. So you probably want to put it on your lanyard or something. I mean, unless you want to stick it under the armpit or something. I don't
The
know.
water's coming down at you, it's gonna get all wet.
Yeah, or have it like on the ledge or something, since it is waterproof. Yeah.
Well, if it's on the ledge, it can't detect your fall.
Oh, like, I mean, like if you have like the soap dish or something, because if you fall, hopefully your arm is long enough to reach that. I would hope. I don't know. That's where you guys are going to have to get creative and figure that one out. Or like you said, you could wear a lanyard and have that around your neck in those cases. But, you know, just a player's choice pretty much. I do like to also mention acupuncture, because this one was a little bit confusing for some people. Acupuncture is available. It's specific for chronic lower back pain. You have to not only make sure that the doctor is in network, but they're contracted to perform acupuncture services. We had a client who went into his primary care doctor and she was like, yeah, I cover acupuncture. He knew he had an acupuncture benefit. He's like, yes, all right, let's do it. Well, she was in network on the plan for primary care physician services. She never contracted with United HealthCare for acupuncture. So guess what? None of those bills were covered. You got to double check. Trust but verify. They did reduce that from $30 to $25, just like the specialist. All right, pop quiz time. How can you guarantee your claims are going to be paid? If you call our office, I can tell you what the copay is supposed to be on your plan, but I can't guarantee that the insurance company is going to pay. That's where you want to get a pre-authorization. Going back to like what you folks were saying, that pre-authorization is going to tell the insurance company, hey, Dr. Smith over here, I want to perform X, Y, and Z procedure for this client, and here is the medical justification why. You will get something in writing from the insurance company that says, yes, this is approved, no, this isn't, and here is why. If you don't get that, let us know. It is your doctor's office responsibility to file the pre-authorization. I'm not saying run a pre-authorization for office visits or lab work or a basic x-ray. I'm talking the big stuff, surgeries, MRIs, CT scans, because those are the big bills you don't want to get stuck with, okay? So when in doubt, request a pre-authorization. Right, another benefit that's not highly utilized that we want to make sure you know is available to you, there is a meal benefit post-discharge. All you have to do is be in the hospital for 24 hours. Give us a call, or you can call customer service. They're going to be able to look up in your claims history that you were in the hospital, and they're going to give you almost a whole month's worth of meals to help you get back on your feet. The last thing they want is after you've had major surgery or a big health issue is to go home. I don't feel good. I don't want to cook, so I'm going to call Domino's Pizza. Probably not best for your recovery. Part of healing and wellness is what you put in your body. So nutrition is key. They want to support you with that. The changes that they made, yes, they reduced the number of days that they're willing to pay. But look at this. They went from only doing it one time a year to however many times that you've actually been admitted into the hospital. So they're going to support you almost a full month after discharge every time you're in the hospital versus giving you 2 months worth of meals once a year. So that's kind of a nice
No,
perk.
wait a minute.
Yeah.
28 days, that's a month.
Oh, I'm sorry. You're right. 28 meals. I was reading 28 meals
Yeah,
as
you
days. 14 days, 2 weeks, but unlimited.
And that's even if you have a wife?
Yeah, if you want to share, there's no fridge police. No one's going, I'm sorry, you didn't eat the meal and it was for you. She can't have any. No, they're not going to do that. You guys can use it however you want. Yeah, you can do that. And they can follow any dietary needs or restrictions that you or your doctor have. So if you can't have salt, they can accommodate that. Absolutely.
Is it connected with Meals on Wheels?
No, it's not. It's through Mom's Meals. Yeah, so it's a different vendor. And again, when we get that vendor list, we're going to send that to you so you guys have the direct phone number. Or again, you can call our office, whatever's easiest for you.
So what kind of meals are like
Yeah, they will be frozen meals so that it's convenient for you to heat up whenever you want, but they're going to have all kinds of options. And when you go to set it up, again, if you have any restrictions, you want to let them know. Like if you don't do spicy food, you tell them, don't give me anything spicy. If you are vegan or vegetarian or whatever, then you can tell them that too, and they'll accommodate those requests. But they're supposed to be nutritious and delicious. So I've not tried one, but hey, it's got to be healthier and better than a Hungry Man dinner, I would imagine. They said that they had their board cater in to actually taste them to make sure that they were of good quality. So apparently it was board approved. All right, another positive. It was already a nice benefit to have major advanced imaging like MRIs and CT scans at $165 copay, considering that those are thousands of dollars sometimes. they reduced it even further down to 125. That's a nice change. We like the savings. So if you need an MRI before you get approved for a knee surgery, now it's only 125 versus 165. And they have never charged for diagnostic mammograms. Your preventative mammogram and your diagnostic are both no charge to you. They do not want cost to be a barrier. Go get the care you need. Go find out, because breast cancer is very aggressive. The same is true with colonoscopies. Preventive and diagnostic colonoscopies are covered in full. Cost is not the reason not to go. I understand, guys, the prep is not fun. I understand. But again, it's a very aggressive form of cancer. Hopefully you only have to do it once every 10, maybe 5 years if there's a history. But make sure you guys are getting those services done. Catch the small stuff while you can. Yeah.
So when on the phone call to the insurance about the MRI, the agent or the representative from United HealthCare said, you can do, it's not the colonoscopy, but we get a kit and you just take a sample and they send it away, and then you get a report back if they found any blood in the stool.
Yeah.
So that was paid for benefit. And I was curious about the mammogram. They have the 3D one versus just the regular. Is there a benefit? Does it cost you out of pocket? And if you do the 3D?
That's a good question. If 3D mammograms are covered.
I've had them.
Perfect.
Yeah.
I was just going to ask Heather to check the evidence of coverage, but she just said she's had it and it is covered. So again, cost, it is cheaper. Think of it this way. It is cheaper for an insurance company to pay for those preventative services to catch the small stuff before it becomes big stuff. It is to their advantage to do that. Absolutely. It is your responsibility to see that through. If it doesn't cost you anything, it's just your time and being willing to go. I understand some people have white coat syndrome. I get it, but sticking your head in the sand and not getting it done doesn't make it go away. So do yourself a favor, because we have modern technology, we have modern medicine, and people are surviving these things if we're able to catch them very quickly. All right, remember I said the specialist copay went down from 30 to 25. Well, a podiatrist is a specialist. We just add extra attention for our diabetics because they got to take really good care of their feet. So make sure you're taking care of your feet. Additional routine foot cares when they will take care of corns, calluses, trimming your toenails if you got really thick toenails or a medical condition where it makes it really difficult to reach. No, Medicare will not pay for a pedicure. I have not convinced them of that yet. But if you go to a podiatrist to get this foot care, it will be covered, okay? And that's, again, at a $25 copay. In the beginning of the presentation, I talked about a skilled nursing facility. Let's actually go over the benefit. Remember, this is like an inpatient rehab facility. So it works similarly to an inpatient hospital stay. Rule of thumb, get better in the first 20 days. You won't pay anything for the first 20 days. In the 10 years I've been doing this, I haven't had any clients say they've been in there longer than 20 days. Not saying that it's impossible. I'm just saying it's not very common. People are usually able to get out pretty quickly. But if you are needing longer coverage or longer services, it's now $196 versus $188 per day for days 21 through 43. So instead of paying for days 21 through 47, you're going to pay a little bit more, but for a lesser duration of time, which is nice. And then days 44 through 100 are covered in full. Medicare on all plans, regardless of the company or plan type, only pays for 100 days of skilled nursing. Because if you're not better in 100 days, you don't need skilled nursing. You need long-term care. Sadly, Medicare doesn't cover that. So this is for a temporary solution, not a permanent long-term solution. Okay? And remember, 3 midnight stay inpatient before they'll pay for a skilled nursing facility. So make sure you double check. Pop quiz time. Every year we send out the postcards about, hey, we're doing these meetings. People ask, well, how do I know I'm on the best plan? How do I know which meeting I should be going to? Let me spell it out for you. I have a little cheat sheet guide. Let's go over it. Are your doctors covered? Probably not a good plan if your doctors aren't covered, right? So let's make sure the basics are handled. Are your doctors covered? Are your medications covered? What services are you going to utilize the most? So we have had where a client has said, hey, I'm going to have a lot of physical therapy. Well, let's look at where we can get the most savings. So if you're able to prioritize what your needs are, that's going to be very helpful. Let me tell you guys, if I put all the plans on a side-by-side comparison and I showed you, you're going to find a benefit on every plan that you like more than this plan. They all have a lower copay somewhere to attract a certain audience. There's no perfect plan that's going to have the lowest in every single category, which is why you have to prioritize. So if your plan is generally working well for you, your doctors are covered, your medications are covered, and you're happy with the changes, most likely you're good to renew. If I saw the next best thing since sliced bread, I promise I'd tell you about it. If I saw a plan where it was 0, 0, 0 across the board, we'd tell you about it. But that's not going to happen because no insurance company can take or afford that adverse selection because then all the sick people are just going to go to them, right? So this is how they kind of keep everything spread out. Are you using all of your benefits? Every year I talk to clients that forget they have an over-the-counter benefit. You're leaving money on the table. If you're not using your dental, your vision, you're paying for hearing aids at Costco versus using the hearing aid benefit. I mean, sometimes it's better, but a lot of times people go, oh man, if I had known, I would have saved so much money. So again, familiarize yourself with all that is available to you and make sure you're taking advantage of what those savings potentials are. Do you feel any cost burdens? This is my best example I can give you. I have a client who's going through radiation treatment. He was on a plan that he was paying 20% co-insurance every time he went in for radiation. 20%. That was really hard for us to quantify and tell him what he was going to pay before he went because it's a percentage. Percentage of what? He goes, Jenna, I'm getting killed on the radiation. Is there anything you can do to bring this cost down? Because I don't know how I'm going to be able to afford keeping up with the treatment if we can't find something better. Looked at all the plans. We found a plan where it was a $65 copay each time he went. He's like, now that I can afford. We switched him over. He did have to give up some benefits in other areas, but his highest utilization, his biggest cost was radiation. Vocalize to us where the hole in your wallet is being burned, and we can help figure that out. Okay? So those are going to be your key pieces to the puzzle. Let's go back to some benefits. Vision. Make sure you're using your vision benefits. The eye exam is covered in full. They will pay for the prescription portion of your lens, not the enhancements. If you want to add anti-glare, anti-scratch guard, transitional lenses where they turn into sunglasses when you go outside, sadly, they won't cover that, but they're going to cover the prescription portion, and they're going to pay $200 a year towards the frames or contacts. Don't leave money on the table. Make sure you're taking advantage. I still have clients that will buy a standalone vision plan to help cover the cost of the enhancements, just like I recommended with the dental. If you're able to get a breakdown of what the charges are from the optometrist office before you rack up the bill, we can compare that and do the math puzzle to see if it makes sense to add a vision plan. Sometimes it's not, sometimes it is.
And they can, if you get somebody that, you know, knowledgeable and for the customer, our vision people play the game, both of them.
Yeah.
And it's kind of interesting because I can get sunglasses and glasses same year with these two, Medicare.
Between a standalone and a Medicare plan. Yeah, it really is a strategy. And some optometrist offices are going to be better than others. Yeah. Sometimes they're willing to help you figure out that math puzzle, and they're willing to bill to whatever is going to be in your best interest. And sometimes they're not, which is why we can do our best to help you and say, okay, if it were me, what I know about all the plans and what you're showing me your recommended services are and expenses for your enhancements, this vision plan would make sense. And let me show you how you could save. So we could do that as well. But absolutely, you should always ask your optometrist office if they're willing to help you figure that out.
So what if you're getting your glasses through these like other places other than doctor places? You know, like like Costco or like What are those?
You have
RMR, the disease insurance is working.
You have to use the in-network providers. I don't know if Costco is in network off the top of my head, but I can have Heather research that and get back to you on that. But there is a home delivery service through United HealthCare, and I'm blanking on the name right now because I'm on the spot. I will find out the name of that. But there's, again, a home delivery service that will send you like up to 5 pairs of glasses for you to try, and then you just return the ones that you don't like. So there's additional options to look at, and we can send you the list of who is in network for you to get the most out of your benefit. Yeah. Okay, this one is a big one, guys. I'm super excited about this. Over the counter. You guys had $80 a quarter to spend this year. It's still going to be $80, but guess what they're doing? They are giving you what's called a U card. So your ID card is going to look very different next year. It is going to be just like how you use it now. You show it at the doctor, you show it at the hospital, you show it at the pharmacy. That's all great. But you now can swipe it when you go to the store, when you go to Walgreens, CVS, Save-On, Walmart, for the over-the-counter items. And right on the price tag, it says OTC approved. So you know what items are actually eligible for that benefit. They automatically load the money on the card. They will reload it every quarter. So you now don't have to order online. You don't have to call it in. You don't have to mail it in. You don't have to wait for it to come to you. You can go to the store right now, or come January 1st, sorry, and you can use that U card. Guess what else is going to be included? I'm going to jump the gun a little bit. Your fitness benefits going to be included on there. You don't have to take a code into the gym anymore. You get to show your card. They'll swipe it, do their thing, and there you go. Go enjoy your gym time. Everything that you need is going to be built in on the card. And again, Member Portal is going to have your balance for that over-the-counter benefit. So if you forget, oh, how much do I have left to spend? Log in, and it'll tell you right then and there.
So you don't.
Oh, sorry. Whomever.
So I usually get my stuff and it comes through Walmart.
Mm-hmm.
Does it only work at Walmart?
Nope,
Does it
it's
work at-
several retail. We're going to get you a whole list of all the retail stores that are included. There's multiple. So you'll have options.
And do you have a list of gyms that works with you?
Absolutely. And I can tell you off the top of my head, I know the big players are in there. YMCA, Axiom, Gold's Gym, Curves for Women. They've got independent cycling studios, yoga studios, bar studios, you know, the dancing bar, not the bar. So yeah, lots of options, independent as well as the big commercial gyms as well.
And the question here too lies, Axiom, we just give them the code and they're done.
Yeah.
And then they give us a little card. And we
Mm-hmm. So now no more code. You're just going to show them your ID card.
Okay, and then if we show them our ID card,
Mm-hmm.
does that come off of our $80?
Nope.
Okay,
Nope,
I just
it is
wanted
a
to
true-
delineate.
Yeah, it is a separate benefit. I just
Okay.
jumped the gun because I was so excited. Yes, Julie.
Anytime Fitness? Is that-
Yes, Anytime Fitness, Planet Fitness, and what's the other one?
That's what I meant.
I think 24, is it called 24 Hour? There's another one that I'm thinking of. Anyway, there's a whole list. It's really hard to find. I know Nampa's Rec Center is still not included though. Crunch, that was the big one. Yeah.
So normally you have to spend $80 at once
Mm-hmm.
and play the game of adding it up.
Not
You don't
anymore.
have to do that?
No.
Oh my gosh.
Isn't that amazing? Flexibility. And you guys have the freedom to go where you would like to. Again, we'll get you those lists of retail stores that are covered, but please be very careful of the materials that United HealthCare sends you. Don't throw out that card. A lot of times people get so much mail, I know, and you're just like, oh gosh, it's probably just junk. You want to be on the lookout this year because this is huge. This is huge.
So it's an actual card?
It is,
that you
it's your
use
ID
at
card.
Walgreens?
It's your new
Oh,
ID
right.
card. It's called a U card. So you're going to get a
Oh.
new ID
Like
card.
Is it
Yep.
the card we
beauty?
carry.
Oh, I don't know. I actually haven't seen it, but I know they're kind of flimsy. They are, and especially with the men who like to sit on their wallets, and then all of a sudden it conforms to the buttock. We know. They don't really last that long. But guess what? We can order a replacement card for you very quickly if need be, and you can always pull a digital copy of that card from your member portal in case you lose it and are waiting for the plastic card to be mailed to you.
So
So backing up to vision, does that cover the office visit?
Yes, office visit is included,
Okay.
zero copay for the eye exam.
Yeah.
Mhm,
Okay.
absolutely, yep, you got it. Again, another benefit that's not highly utilized, nurse line. I know you're thinking, oh, I'm probably not gonna use it. Again, we're gonna use story time because I think that helps resonate the importance of these things. I use the nurse line. I use the nurse line when I got bit by a spider. We have that brown recluse thing here that you got to be worried about. Well, I didn't see what bit me, but man, was it an angry bite, and it was getting pretty swollen, red. And I was like, okay, I can go to the emergency room, be there for hours, spend God knows how much money because the emergency rooms are very expensive. Kind of don't want to do that, but I also don't want to be the dum-dum that neglects my health care because I'm trying to save a quick buck. So let me call the nurse line. So I called the nurse line. I said, hey, what do I need to know about this spider bite? Like, is there anything I should be doing? Do you think I should go in? She went through a whole list of symptoms. Do you have blurry vision, nausea, dizziness? I mean, she went through this whole list. I was like, no, I don't. She goes, okay, here's what we're going to do. You're going to grab a Sharpie. You're going to draw a circle around that. You're going to write the time. So if you do need to go in, they can track and see how quickly this is spreading and swelling. And I want you to make a paste. I think it was like baking soda and water, and slather that on there to help extract the venom. She goes, if you get any of these scary symptoms, I want you to go in. Or if that swelling continues to go past that line in a really rapid rate, then you can go in. All right, perfect. My anxiety went down. I was like, yes, I took charge. They can give you all kinds of tips and tricks, over-the-counter remedies. They can help, again, navigate you to the closest facility. They can even call in advance. You're talking to a registered nurse. So if you're trying to save money and time, and you also, again, don't want to neglect your health care, that vendor list is going to have the nurse line on there. You can ask those questions very quickly. Okay?
What happened?
That was fine. It went
Well,
away. Oh, yeah.
Didn't go beyond your.
Nope, didn't go beyond. I overreacted, so that's why I used the nurse line. Yes,
Can
Julie.
any age use that nurse line?
It does have to be to the member specifically, yeah. I wish it was available to the whole family. Yes.
Where do you find the number?
We're gonna send that to you. We don't have the new number for 2023. Heather keeps checking daily, so as soon as we see it post, remember, a lot of the materials won't officially become available till October 15th because they don't want us to use them too soon and then people get confused. But we do have the 2022 list that we can send to you.
Well, I just had that same thing.
Did you see?
Firefly.
Yeah, you just don't know. And it just gives you peace of mind. So, and again, you can be in charge of your healthcare without overspending and overdoing it. It's a quick phone call.
Is that like Ask a Nurse?
Yeah, they are registered nurses.
Okay, because I've called Ask a Nurse before, but not on my insurance.
Oh yeah, no, this is specific through the insurance company. I just like it because there's usually less of a wait. Usually they pick up and it's 24/7. So if it's 3:00 in the morning and you're freaking out and you're at, maybe you're having a side effect from a medication or whatever it may be, you can call anytime. Midnight, 3 a.m., doesn't matter. I like that. Fitness program. Remember, bodies in motion tend to stay in motion. You're going to use the U card, no more code. You do have access to online classes, brain classes, which is really cool. They're all online through your member portal. Member portal. Say it with me. Member portal. Yes. I really want to drive that point home because there's just so many improvements they've made to that. So it's actually worth your while to look into. And again, if you need help, our friend Levi is going to be your tech wizard that can help get that all set up for you. Routine transportation. Let's not forget gas prices are going up and they keep going up, which is not fun. So if you need help getting to and from your doctor's appointments or to the pharmacy, they're going to give you 12 one-way trips, or you could do 6 round-trip visits. You do need to schedule this 72 hours in advance. It's not like an on-demand Uber ride, unfortunately, but it can save money. So if you know you're going to go in for a dental procedure where they're going to give you the good drugs and you shouldn't be driving after, could be a nice perk. No, they will not pick you up from the bar. So guys, it has to be for a medical reason, unfortunately. But again, that vendor list is going to have the phone number on there, so you can just keep that right on your fridge. And anytime you feel like you need a ride or you want to save gas money, go for it. More best practices. I talked about in the beginning, read your summary of benefits. Everybody here has a copy of their summary of benefits. Please keep that handy in an easy to find location so you guys can know what you're going to pay before you go. Remember, it also helps you understand if you are being billed correctly. Hang on a second. My summary of benefits says this surgery should have only been $200. How come I got billed $300? That's a problem. Time to call Shores Insurance. Read your explanation of benefits. Make sure you're getting charged for the right services. Sometimes doctors charge for things that you didn't have. Sometimes the wrong codes are being used, so it keeps them honest. That explanation of benefits tells you what was billed to the insurance company, what they paid, and what your responsibility is. You should not be paying the bill unless the patient responsibility on the explanation of benefits matches what the billed amount due is. If there's a discrepancy, there's an issue. It's very misleading when you get a bill and it says insurance adjustments right on there. You're going, oh, they applied my insurance benefits. No, it's a guesstimate of what they think your insurance is going to pay. Online, when you go into your member portal, you can pull a digital copy of your claims. Sometimes you will see several claims for the same date of service from the same doctor. You'll see denied, 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 pending. You know what that is? It's a billing issue. Doctor probably didn't use the right codes. Doctor forgot to send in supporting documentation. You are not obligated to pay that bill until the claim is fully processed. If anybody gives you guff, I want to know about it. Okay? All right. Any questions? Yes.
So if you're traveling abroad,
Yes.
or even anywhere, I guess, is your insurance company going to be the same in South America or Puerto Rico as it is in?
Great
Meridian,
question.
Idaho?
Yeah. So for those who are online, the question is if you're traveling abroad, is the insurance going to be the same like in Puerto Rico or wherever? Now, Puerto Rico is a U.S. territory, so they would be able to bill. But if you go to France and you show your U card, they're going to look at you like you have 7 heads. They're going to, what the heck is that? We don't have insurance here. We have universal HealthCare. So when you travel outside of the United States, it is a reimbursement basis. We highly recommend a travel plan. We like to use the company Geo Blue. They're very easy to work with. They pay for things up front. They pay for translation services, including translating your medical records into English. It's very affordable, and it is true medical travel coverage. We're not talking about your flight, your hotel, your luggage. We're talking true medical. They will pay to bring you home or bring family to you if you're incapacitated and you need somebody to come to you. So it's a really great benefit. All we need is your travel dates. We were able to help somebody get travel coverage for a couple of weeks for less than $200, and they had up to $1 million of care per person, which was awesome.
You said G-O-G?
Geo Blue. Geo Blue. Oh, one word. Geo Blue.
Okay.
So that's a great question. When you're in the United States, it works just the same. So you just show your ID card. It would be just like going to a hospital in Idaho, and then you'll get those bills and explanation of benefits in the mail.
So in South America, we would have to pay.
I would,
by
because
cash or-
yeah, exactly. Because
If
if
you
you went to, South America, they're not going to go, oh, we'll wait till you get reimbursed by Medicare. They're going to ask for payment up front. So you would have to pay that and then file for reimbursement with Medicare. And Medicare will reimburse typically up to a certain amount. So again, if you want a personal guarantee that you're not going to be stuck with a very large expense, I would do the travel benefit.
We did get travel insurance, but I just was curious if, say, you sprained your ankle.
Yeah.
Or a broken arm or something, you don't want to wait till you get back.
No, you don't.
Country to have anything done.
Exactly. Yeah. So in those cases, again, I agree that a travel plan would be the best, just for peace of mind. And again, then you don't have to worry. And if you need to come home because you don't like the quality of care that you're receiving, that's important too. We heard a story of a client that went to Ireland on a cruise ship and did one of those offshore excursions. She was in a power wheelchair, ran over a rock that caused the whole thing to go topsy-turvy. She fell, broke her hip, was stuck in the hallway for 2 weeks, wasn't even assigned a room with no surgical plan. She had no travel coverage. This is in Ireland. Yep. Had no travel coverage. Her family had to exhaust the cash value built up in a life insurance policy to afford to pay for the medical transport to bring her home. Terrible experience. Ever since then, I make sure people know about the travel insurance. It's those kinds of stories where you don't want to be the person who learns the hard way. Yeah. Okay. Any other questions? Yeah.
Immunization, vaccinations.
Yeah.
Did I miss that or?
Immunizations and vaccinations are going to continue to be covered. The ones that are covered in the United States, not the ones that are needed for foreign travel. There has been new legislation that has passed to move a lot of the vaccinations like Shingrix to a zero copay. So that's going to be coming. So if anybody needs the shingles shot, that could be something we want to investigate ahead of time and make sure that this plan's going to include that. It's actually a federal law, so those should be incorporated on all plans. But sometimes you have to make sure you're going to the in-network pharmacies. So again, just call our office and verify that with us. In the past, I know that that's been an issue we've talked about.
And we talked about that. And we got one of the shots. And it was a matter of the insurance company not making it an immunization, but making it a medication.
Right.
And that's this company.
Yeah.
And so that was, I called the company and had it out with them. Okay, then tell me why they call it a vaccination.
Yeah.
And they couldn't answer that. They didn't have it. So
Sometimes, yeah, it's kind of fun.
I didn't get into relief, but still.
I know it's a tricky one, but they finally have addressed that. It's reached the federal level that they've actually passed a bill about that. So that's good. It's coming in the new year.
So what age is Medicare again?
65. But if you are on Social Security disability for 2 years or more, you can qualify younger. Or if you get diagnosed with ALS or end-stage renal failure. Those will get you, so that's the kidney disease. Those will qualify you prior to age 65. Other than that, you got to wait till you age in. So I call it the Cool Kids Club. You get a card and everything. Yes.
I recently got Medicare something for some medical that I had, and on it, part of it was denied. And I wondered, do I have to file an appeal to get them to look at that, or do I need to go through the hospital? I believe it was a CT scan.
I would send a copy of that to our office. Let us look into that, and then we can properly navigate you with what the next steps are. So if you guys get a denial and you're like, what am I supposed to do? What does this mean? What went wrong? Send us a copy. And again, our main office number, 208-321-4621. You can text and you can send picture text messages. So if it's quick to just zap a copy and text it, we'll jump right on that and get you guys a response so you know what the next steps are. Yeah.
But when they give you a denial, aren't somebody working on it?
Should be. Somebody should be working on it when there's a denial, right?
Yeah.
But I would never assume that anybody is doing their job nowadays, especially with people working from remote. We get that all the time. So no one is going to work harder for you than you. So that's why we're saying we got to take the ownership, and then you reach out to our office and we'll help you along the way.
Well, I called the doctor.
Yeah.
Instead of you, but I didn't want to bother you. But anyway, and they said, oh, okay, we'll work on it, probably a code thing. And indeed it was, but there was one time, real interesting, I had my surgery.
Uh-huh.
And the doctor had billed insurance, and that was gone through, but they had another doctor in there, maybe an associate, maybe somebody that was learning, whatever. And she was billing it too, the same prices.
Oh,
they were all denied.
Oh, duplicate billing.
Yeah.
Yeah.
And so I asked into that. Yes, indeed, this doctor was in there, and I found blah, 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 and then all of a sudden it disappeared. So,
yeah.
Interesting.
See, this is what I'm talking about, checks and balances. They're making sure there's not abuse, fraud, or errors. So there sometimes you as the client get to be on the other side of that with all the denial notices and whatnot, and then that puts a lot of fear and uncertainty. Oh my gosh, what am I going to be ending up with? But that's again where we can help kind of consolidate that. Call us. That's what we're here for. Yes, Frank.
Explain this good RX card and how that might be used.
Yes, the Good RX card that's in there is just a free coupon service. We often will compare your drugs to Good RX. Sometimes Good RX has a better price. Now that United HealthCare has gotten rid of their deductible, it might be hard to find a better price through Good RX, but it just depends on the actual drug. So I'm going to recommend, Frank, that you send us your list of drugs and I can do that homework for you. Let me show you what it's going to be covered with United HealthCare, and if I can find savings through Good RX, I'll let you know so you can start using that because it's free.
Yeah, and it really works. I mean, I have a drug that's way overpriced. You get RX cut it down by 93%.
Let's mention that the donut hole because my medication, I get the donut hole in the first 30 days of the year.
Yeah. So donut hole is going to be for, again, those people who have expensive medications or a lot of medications. So once you hit, and then look at that, you should have the little, oh, here we go, this little pink sheet. Can I borrow this for a second? I'll give it right back. Oh, this one's blank one. Okay, perfect. So we have the 2023 amounts, $4,660. When you and the insurance company together have spent $4,660, you are going to go into the donut hole. Okay. The copays that we had up on the screen, let me back it up here. Hang on one sec. These copays that you see for prescriptions, this goes away. When you're in the donut hole, you pay 25% of your medications. Now, how do you get out of the donut hole? It's all you, toots. Everything that you pay up to, this is the next part, $7,400. Your 25% has to accumulate up to $7,400. Now, if you're taking name brand medications, they're going to give you that 75% that is being paid by the insurance company to help count towards that $7,400. Only on name brand, not generic. It's a little complicated, I understand. But again, when you're in the hole, so once you've hit $4,600, you're now going to get rid of this. You're going to pay 25% until you have paid out $7,400. Plus, they're going to give you that credit for your name brand medications, and then you'll go to 5% or those. There's some lower numbers. You pay. It's most people will pay 5%.
Does the 7,400 count the 4660?
Does not.
So you got to pay the 4660, then another 7,400.
That's right. That is right. This is why, again, we have to use GoodRx. We will use manufacturer coupons that work with Medicare, because not all of them work with Medicare. We have to sometimes look at the patient assistance programs through the hospital. There's another flyer under there, Frank. It looks like this, ways to save on prescriptions. So this is where it talks about GoodRx. We also have that universal prescriptions mail order service where we get meds through Canada, UK, New Zealand. So please send your list. Let me do that math puzzle for you and see if we can find some savings. Sometimes we can't, but a lot of times we can. So it just depends on the drug, because each drug is tough. I've got some clients that are taking a medication. There's a cure for hepatitis, by the way. Woohoo, modern medicine. It's incredible. It's an 8-week treatment. It's $1,000 a pill, $83,000. Very expensive medication. So we have to get creative, and we're able to find some, again, resources to help cover that cost. Now, that medication is supposed to go up. Once the patent runs out, or as we get closer to the patent running out, that same drug, no change in formulary, no change in packaging, is going to go up to $250,000 just because they can. I know. Big Pharma, not a big fan. Don't get me started on that. This water bottle ain't strong enough for that conversation. But it is tough. It absolutely is. There's some legislation that they're trying to get through to help bring drug costs down. Sadly, it's not getting pushed through fast enough. And it's going to be kind of a slow thing, but Medicare has had that issue for a long time with prescription drugs, which again requires us to get as creative as possible. You want to also ask your doctor if they have any samples or any programs in their own office, because a lot of times when they partner with these manufacturers, they're able to give out discounts or fill out an application for a discounted price for you. But again, that's sometimes, and it has to be initiated by the doctor's office. So I would just at least ask like, hey, this drug is really expensive. Do you have anything that can help cover the cost with this? And see what they say. Good question. Any other questions? All right. Any questions online? Please go ahead and submit those. In the meantime, while you guys are marinating on that, I want to remind you of the dates. Annual enrollment period is October 15th through December 7th. So we're using this lead time to tell you how your plan is changing. If you are interested in an appointment, we have dates and times that we've blocked out on our calendar. You guys can sign up at the sign-in sheet there. If you want to renew your coverage and you want your renewal packet with all the goodies, go see Heather in the back. She'll make sure you're on the list, verify your address, and make sure you get that information as quickly as possible. This is the time to change your plan. You're allowed to change your mind anytime you want. So if you say you want to renew and then a month from now you go, hey, you know what? Actually, I do want an appointment. Just give us a call. No big deal. But you can change your plan as many times as you want, but the last plan that was submitted December 7th is the one that will go in effect January 1st. If you don't want to change your plan and you just want to renew, you don't have to take any action. It's already set to automatically renew.
So you don't need to check in?
No, but we would like to know if that's your intention, just so we can make sure you're on our list to send out the renewal packet. If we don't hear from you, we'll make that assumption, but it gives us warm fuzzies that we have some sort of verbal. Yeah, then we don't feel like we've missed anything. Yes.
I was just curious, so, the gal behind me who had found out she has to have a root canal. If you could wait, can you postpone that till after the new year?
Oh, yeah.
And like any other procedures medically or whatever?
Absolutely. Sometimes there is a strategy with it.
Say that I'm
Absolutely.
okay, but can I wait till after January?
To get the better benefit. Absolutely.
For
I would just recommend making sure it's not detrimental to your health to
Right.
wait, that it
Of
doesn't
course.
cause more problems than not. But other than that, yeah, if it's something elective that isn't going to worsen by waiting, there's no issue with doing that. Absolutely. It's your choice.
So, and I remember from last year, so then you find out that something in your health changed, so you can change your plan to a better benefit, like say in November.
Yes.
You can't, if we're just, you needed to.
Yeah, absolutely. So if something changes between now and December 7th, you just give us a call. But keep in mind that the plan changes will not take effect till January 1st. So yes, we have all these opportunities to meet with one another, but these changes won't take effect till January. Okay, great questions. I hope you guys found this meeting to be informative. We really want to empower you guys. Remember, we're here for you. Thank you so much for your time. I want you to go into 2023 with confidence. So I look forward to seeing all of your doctor lists and prescription lists so I can just do my Jenna double check, okay? All right, guys. Thank you guys again. Help yourself to snacks and just enjoy the rest of your day. Thank you so much. Thank you for joining us online. I appreciate you.